Kissing and kissing disease. What you need to know. Kissing is a universal gesture of affection, but while most sexually transmitted diseases, STDs, typically require more direct contact, a few infections can also be spread through kissing. This is particularly true with deep or open mouth kissing, where saliva exchange occurs. Here's a look at the primary infections to be aware of, including those often referred to as kissing diseases. 1. Herpes simplex virus, HSV1 and HSV2. The herpes simplex virus, HSV, is one of the most common infections transmitted through kissing. While HSV1 is typically associated with oral herpes, which causes cold sores around the mouth, HSV2, usually linked to genital herpes, can also be transmitted orally. HSV1 spreads easily through direct contact, and kissing can quickly pass this infection from one person to another. Once contracted, herpes is a lifelong condition that can remain dormant but reappear as painful sores around the lips, mouth, or other areas. Prevention tip. Avoid kissing when visible sores are present, and practice good hygiene to reduce the risk of spreading the virus. 2. Human papillomavirus, HPV. Human papillomavirus is one of the most common viral infections worldwide, with various strains that can affect different areas of the body. Although it's rare to contract HPV solely through kissing, certain types of HPV have been detected in the mouth and throat. This can lead to oral infections, and in rare cases, some strains can increase the risk of oropharyngeal cancers. However, transmission of HPV through kissing is still considered uncommon. Prevention tip. HPV vaccination can help reduce the risk of infection, especially for the more high-risk strains associated with cancer. 3. Cytomegalovirus, CMV. Cytomegalovirus is a common virus that belongs to the herpes family. It can be spread through bodily fluids, including saliva. For most healthy individuals, CMV doesn't cause noticeable symptoms, but for those with weakened immune systems, it can lead to flu-like symptoms and more serious complications. CMV is usually asymptomatic, but can be a concern for pregnant women and immunocompromised individuals. Prevention tip. Practicing general hygiene like not sharing drinks or utensils can help reduce CMV transmission risk. 4. Syphilis. Syphilis is another STD that, while uncommon, can be transmitted through kissing if sores, called chancres, are present in the mouth. These sores are infectious and can theoretically spread the disease if a partner comes into contact with them through open-mouth kissing. However, this transmission method is rare, as syphilis is more commonly spread through sexual contact. Prevention tip. Be mindful of any unusual sores in or around the mouth. If a sore is present, it's best to avoid kissing until it's been checked by a healthcare provider. 5. Mononucleosis, Epstein-Barr virus. Mononucleosis, or mono, is often called the kissing disease because it spreads easily through saliva. The virus responsible, Epstein-Barr virus, EBV, can cause symptoms like fatigue, fever, sore throat, and swollen lymph nodes. Although not classified as an STD, mono can be quite contagious and is typically passed through kissing, sharing utensils, or close contact with infected saliva. Young adults and teenagers are most commonly affected. Prevention tip. Avoid close contact, especially kissing, with someone who has mono symptoms or has been recently diagnosed. 6. Gonorrhea. While less common, oral gonorrhea is another infection that can be transmitted through kissing if an oral infection is present. Gonorrhea in the mouth can cause symptoms like sore throat or swollen lymph nodes, though it's often asymptomatic. Transmission through kissing is rare, as it is more commonly spread through sexual contact. Prevention tip. Regular testing for STDs and good oral hygiene can help prevent the spread of oral gonorrhea. Reducing the risk. While kissing is generally safe and a low-risk activity for most people, understanding the potential for infection is essential. Here are a few tips to minimize risks. 1. Be aware of symptoms. Visible sores, flu-like symptoms, or any other abnormal oral symptoms in yourself or a partner could be a sign of infection. When in doubt, it's best to hold off on kissing until symptoms are checked by a healthcare provider. 2. Practice good hygiene. Avoid sharing personal items like utensils, straws, or toothbrushes. Good hygiene can reduce the risk of spreading infections, especially those that may be asymptomatic. 3. Vaccination and regular health checks. Vaccinations for certain viruses like HPV can help prevent infections. Regular checkups are also helpful, particularly for those with higher exposure risk. Kissing is a natural expression of affection, and while the risk of serious infection is generally low, it's wise to be informed. Recognizing the symptoms and practicing good hygiene can help prevent the spread of these infections, allowing you to enjoy safe and healthy relationships.